So I'm very delighted to welcome all of you for this Indo-UK digital symposium on stress, mental health, and mental illness. Uh, we have two distinguished guests for the honor, and I'm first thank both Dr. Afsal Javed and Professor Pratima Murthy for agreeing to be part of this program. So before we proceed into the full program, I will just tell a few housekeeping. Most of you know about these things, but still it is important that I repeat. First is mute audio and videos when you are not actually interacting. This is just to avoid unnecessary noise. And use the chat button if you have any comments to make. And one of our organizers will pick up that and pass it on to me, or will respond to that accordingly. If any of you face any technical problem, please log out and log in, and many times that resolves the issue. Or a worst scenario, you can try use a different instrument, maybe a mobile phone if the computer is not working. Hopefully those will take care of these issues. And despite that, if there are any problems, please do contact one of the organizers, Dr. Suresh, Dr. Naveen, or Dr. Manjunath. They will be able to assist you. Yeah. First thing, I would, on behalf of the editors, Professor Chaturvedi, N. Manjunath, and associate editors, Dr. Yamini Devendran, and Dr. Shalini Nayak, I would cordially welcome all of you for this book release and also for the subsequent program. The program consists of book release followed by two panel discussion and then an informal discussion with Professor Chaturvedi to that valedictory. So now first I would like Dr. Afzal Javed to inaugurate, release the book. He has warned me not to embarrass him by telling too many things about him. Many of you know him, so I would go very briefly about a few things of Dr. Afzal Javed. Afzal Javed is consultant psychiatrist and honorary professor and clinical professor of Warwick Medical School as well as Birmingham University, and he has been served in several positions in Royal College of Psychiatrists as Deputy and Associate Registrar and Chairman for West Midlands Division. And all of you know about his international work. He is currently the President of World Psychiatric Association from October 2020. He was also past President of Association for Psychosocial Rehabilitation for 3 years from 2012 to 2015, and he was also past president of Asian Federation of Psychiatrists Association. So his special areas of interest include transcultural psychiatry, psychosocial rehabilitation, psychiatric research, and his academic skills are invaluable. He has published several scientific journals in the reputed journals. He has authored 6 books and monographs, and he's continued to be involved in his academic activities despite he's retired from a consultant job where he worked in my trust, Coventry and Warwickshire Partnership Trust. This is his professional achievement, but I would like to tell you that at an individual level, having worked with him as my colleague, he is guardian of many psychiatrists in UK and especially in West Midlands area. I'm sure many people's career development has taken a very uh, positive trajectory following interaction with him. He's always been kind, supportive, very approachable. It's an honor and privilege to have you, Dr. Afzal Javed, and I would like now to inaugurate uh, the book release.
Well,
So this Stress and Struggle, the comprehensive textbook of psychiatry, has more than 700 pages. We have divided this into 5 parts. It has 36 chapters, and 69 eminent people have contributed as authors. And I am immensely thankful to all of you for your hard work, and thank you for actually tolerating our repeated reminders. It's a great that you have been contributed to this chapter. And the book has more than 1,000 cross references and 100 illustration and figures and tables. These are extremely useful for many trainee psychiatrists and anybody who is actually involved in teaching or in teaching about stress. The part one consists of basics of stress, and you can see the contributors for the chapters which involves the basics of stress. That includes biology of stress, conceptual issues about stress, biological markers, biology and resilience, stress and aging. The part two of the book is related to the specific aspect of specific disorders caused by stress. It means that these disorders would not have occurred without a stress. So this is specifically for stress related disorders. And part three is about stress and its relation to the specific mental disorders. We have tried to cover as many different psychiatric diseases as possible, and we have more 10 chapters on this, and this covers most important aspect about the stress and relation to the mental illness. And the part 4 is about specific population and how it affects stress. And we have 7 chapters on the 8 chapters on this, and this provides specific information. If anybody is working in, say, for example, occupational health, they can directly go into this chapter and look into the stress and its effect on the occupation. And the final chapter is about the management of stress, both a general management and also specifically looking at how psychopharmacological and psychological treatment can be used to treat stress. And also there is a separate chapter on traditional methods of stress management, including using telepsychiatry as well as preventive aspect of stress. I thank all the authors who have contributed to this, and especially thank you for Dr. Absal Javed for agreeing to write forward and his continued support and encouragement whenever I needed some help. Many thanks to you, Dr. Absal Javed. Now I would request you to address us few words.
Well, good evening and good afternoon to our friends who are in UK or this part of the world. Dr. Somashekar, Professor Chaturvedi, Professor Pratima Murthy, and dear friends. It is such a pleasure and privilege for me to join long-standing friends in a very important academic activity. I know most of the editors, but especially Professor Chaturvedi for a number of years. His name and his association with NIMHANS has always been a source of inspiration for many of us. Similarly, the faculty of NIMHANS is such a great faculty in this particular part of the world that not many Western centers can enjoy that privilege. And again, coming to the academic contributions, the contributions from the alumni of NIMHANS, but not specific to NIMHANS, all the other postgraduate institutes in India, is certainly a way forward in terms of looking at some role models. This particular book is very timely publication. We are passing through such a stressful phase that none of the members of the society can say that they have not suffered or they have not passed through a phase when they are anxious, worried, and stressful. The link between stress, positive mental health, and mental disorders is equally important. And as Dr. Somashekar has mentioned about the contents, I think the editors have not left any room for any further progress. I'm 100% sure this will be a book not only helpful for psychiatric trainees, psychiatrists, or those people who are choosing psychiatry as a future career, this will be equally an important book for non psychiatrists, other mental health professionals, and many of the professionals working in non mental health settings. I once again thank and wish all the editors a big success. And I must say that NIMHANS will be proud of this publication coming from a very important and very big name who has contributed in different aspects of mental health, not only in India, not only in the region, but also worldwide. I once again thank and hope that Professor Chaturvedi will not be retired. Actually, retired means retiring. So he will probably be more active. And I was speaking to him the other day, and he was very kind to really offer his services to promote education, teaching, and training from the platform of WPA. So I, on my personal behalf and on behalf of World Psychiatric Association, thank the organizers for inviting me and giving me this honor to be linked and to be associated with this highly important publication. Thank you very much, Dr. Somashekar. I look forward listening to other discussions and points, and also look forward reading this very, very relevant and appropriate publication. Thank you very much.
Thank you, Dr. Absal Javed. This is an honor for us. And now I will ask Dr. Pratima Murthy, who is a professor and head of the Department of Psychiatry. And I'm sure most of you know her, and still I would like to introduce her formally for the purpose of the meeting. As you know that she has obtained both her DPM and MD from NIMHANS, and she was the outstanding student, and many of our contemporaries knows her for her leadership qualities when she was a junior, when he was a senior resident and junior resident. So after that, she has obtained diploma in psychiatry from University of Manchester. She's a fellow of Royal College of Physicians and Surgeons, UK. She is a recipient of several national and international awards, notably the Raja Ramanna Award for Outstanding Contribution in Science, awarded by Karnataka government. And our area of interest is treatment and treatment of addiction. And she is instrumental in expanding the de-addiction department in NIMHANS. Fortunately, I was there when she was doing a lot of work in related to that area. Now it has grown up itself as a separate department. In addition to that, she is continued to be a trainer in this same area and an international trainer for World Health Organization, United Nations drug control programs, ILO, and many other international organizations. Our areas of interest are human rights of people with mental health, and she has written several reports. She has authored reports for National Human Rights Commission of India, and she also has special interest in history of psychiatry. These are, as I said, are professional attribution, but personally, I'm sure most of the trainees and most of the students who have worked with her know her for humbleness and easy accessibility. And she's always helpful to any resident, any young junior doctors, any young consultants in their development, and identify their strength and encourage them to be a good psychiatrist. It's really a great privilege and an honor for Dr. Pratima Murthy to agree to be the part of this program. Now I would request Madam to address us and wish us good luck. Yeah.
Thank you. Wonderful to see you, Somshekhar, and thank you for bringing everybody together. Professor Absal Javed, Professor S.K. Chaturvedi, my colleagues, Dr. Manjunatha, Dr. Yamini, Dr. Shalini, most importantly, friends predominantly from the UK. Just before the program started officially, Dr. Chaturvedi said it feels like we're in the UK, and it certainly does. And I think for me, one of the greatest things is that it's brought together so many names, which I'm actually going to take the trouble of mentioning personally because it's wonderful to see you all online. Professor Afzal Javed, thank you for being here with us this evening. It's a great honor and pleasure to have you with us. I recall a very brief meeting before this online, reconnecting when I had the pleasure of having dinner with three presidents of the World Psychiatric Association, two former, and one was going to be the president. So I think it's the WPA is in great hands, and I'm sure we all look forward to your leadership. And again, thank you very much for supporting this endeavor. And secondly, let me say that it's a real pleasure. I've just been noticing, and I'm sorry if I leave out names because I know many of you have joined later. But when I initially, joined the whole thing, I saw very lots of familiar names. I saw Balaji's name, Ashok Kumar, Anil, Dr. B.K. Singh, Siddharth, Supriya, Suresh, and Rupali, Neil Madhavkar, Nishant Goyal, Prakash Hosalli, to mention a few, Dr. Ravi Gupta, Dr. Srinivas Murthy, and of course, Savita Shri and, Sagnik. So it's wonderful to see all of you. I'm sorry if I've left any names out, but Dr. Afzal Javed mentioned that NIMHANS is great. It's all of you, not just the faculty in NIMHANS, but all the alumni of NIMHANS, which actually makes it great. So, and I think someone mentioned many years ago that if you've passed through NIMHANS, the umbilical cord to NIMHANS never severs. So I think to that extent, we're all, very happy to be together. And on this occasion, I think there are two very important things. One is the book that is being released, and it couldn't come at a more opportune moment than this. Because I think in the last year, the whole world has known what stress is. In addition, unfortunately, the world has known what stress is, particularly during the times of the COVID, but the resilience and support is a very important thing that people must know during the COVID times. So I think it's a very opportune time for this to come up. The second thing is that, stress, I always remember when I read about stress as an undergraduate, the Yerkes-Dodson law, that an optimal level of stress is very important for productivity. But I think over time we understand that different people have different abilities to deal with stress, to cope effectively, different levels of resilience. And I think it's a great challenge to be able to help people recognize these their levels of homeostasis and how to improve them in a constantly changing world. So I'm sure this book is going to be enormously useful to people from all walks of life, health professionals, mental health professionals, perhaps even the lay public, to understand the importance of dealing with stress. So I'm sure it will be very well received. And as mentioned, it's a comprehensive book of stress, mental health, and mental illness. So I'm sure it's very going to be very useful. The second important event, of course, is that this month has been the Professor S.K. Chaturvedi month. Although we've recognized Dr. SKC's contributions all along, I think there have been several activities already, and various people have highlighted the important contributions that Professor SKC has made. And we all know, just like Somshekhar mentioned about Dr. Absal Javed, Dr. SKC has always been a mentor par excellence. And, so I'm one of the early mentees as well. So he was telling us the other day that we're all his students in the department. So I think it's been very nice to see how, how effectively he has mentored a whole lot of students. And many of them here are the editor. I mean, practically everybody as an editor or a co-editor are his mentees. So I think it's very nice to see this very important body of work being brought out, and that Professor SKC is involved with this. I know that Dr. Afzal Javed, you mentioned that the thing about retiring, but I'll say that Professor Chaturvedi is never tiring. So so I think when one mission is over, he starts on another mission. So I think that's going to continue. And well, Nimhans's loss at this point in time may be somebody else's gain. So we'll have to wait and see how that unfolds, and how Dr. Chaturvedi will continue to not only mentor people from all over the world, but Nimhans as well. So I'm very, very glad that this book is being released, in some ways to commemorate the kind of contribution that Dr. SKC has made, particularly in the area of what we call liaison psychiatry, and in particular about stress and dealing with stress. I know that there are colleagues from the mental health education department who are here, and Dr. Chaturvedi has headed the mental health education department and catalyzed it into doing many activities in addition to whatever else we've heard of. Uh, Finally, I'd just like to say a personal word of congratulations to the young colleagues who have been involved in bringing out this book. Somshekhar, of course, is an alumnus of NIMHANS, and I think he has continued to work with several of the faculty, and it's wonderful that he's brought the whole team together. But as he very humbly mentioned, while he catalyzed it, I think it's the other people who also brought it all together into fruition. So anyway, congratulations, Somshekhar, for this untiring effort. Secondly, Manjunatha. Manjunatha is one of our young faculty, and Manjunath has a very keen interest in community psychiatry and has been working with other colleagues in the community psychiatry team to make mental health care available to people closer to the community. He's very passionate about training. So he has been training people in community mental health care, particularly doctors and other health professionals. And I think obviously this is a matter of great pride for him to be associated with this important this important publication. So congratulations to Manjunath. Professor SKC, what can I say? Congratulations once more. And then the young associate editors who were actually flanking Professor Chaturvedi, and I'm sure whom you'll see in more detail, Dr. Yamini Devendran and Dr. Shalini Nayak. They've been excellent in their areas of work, both as clinicians and as people who've been involved in training and research. So I think it's a fantastic team that's brought together. And I love the Rubik Cube on the cover, because I don't think I've ever been able to do the Rubik Cube. So, so I think it's really about juggling, about managing, about being able to, to balance things in life and emerge out of any stress that we have. So I'm on the hope that this will teach people not just to know about stress, but how to overcome stress, how to overcome, mental distress and mental illness, and live a happy, productive life, I hope, is the final ultimate outcome of this book. Congratulations once again, and thank you for asking me to speak. Thank you.
Thank you very, madam. Thank you, madam, for your kind words and encouragement and appreciating our efforts. Now we will move into the panel discussions. We have two panels. One is on current understanding about stress as a cause of ill health, and the another one is about the recent advances in the management of stress. The first session will be chaired by Dr. Savita Shri Eranti and Yamini Devendran. So first, I'll introduce Savita Shri. So as most of you know, she is an immense alumnus after her training. So she's now working as consultant psychiatrist and outcomes lead in East London NHS Foundation Trust. Uh, she's also regional lead for psychosis at NHS England and NHS Outcomes. Her special area of interest are repetitive transcranial magnetic stimulation, psychosis, and depression. She has several publications and presentations to her credit. And second chair is Yamini Devendran. So she is a young consultant psychiatrist, worked as assistant professor in psychiatry after having trained in Bangalore Medical College and then in NIMANS. So she's done fellowship in psychosocial medicine. She's also pursuing diploma in child rights law from National School of Law, Bangalore. She is also continued to be interested in teaching, and she is editor of Mind newsletter, and also involved in many other areas related to teaching. Our special interests include sexual health, child sexual abuse, autistic spectrum disorder, and suicide, to name a few. Now, I would ask both of you to proceed from now and introduce the panel members and start the first panel. Savita and Amini, please.
Thank you very much, Dr. Somshekhar. And Somshekhar has been my colleague back in the months. And it's a pleasure to be here. And in fact, when I was first asked to chair this session, I recalled authoring a chapter in my training days with Professor Chaturvedi. And the title was Stress and Immunity. And I couldn't believe after all these years I'm here at a release of a book about stress and with Professor Chaturvedi's important program here. It's a pleasure being here. And we have a panel of experts, and we've been given about 30 minutes for this session. So in the chat function, if the audience want to write some comments or questions, we'll try to fit it in, or we'll sort of take it for discussion after the panel. What I will do initially is introduce some of our UK speakers or expert panel members, and then hand over to my co-chair, Dr. Yamini Devendran, to introduce the other panel members. In no particular order, I'd like to welcome Dr. Rupali Suresh, who is a senior clinical psychologist and works at the Essex Partnership NHS Trust. Her area of expertise is old age psychiatry and working with old age group. Welcome, Dr. Suresh. Next, we have hello. And next we have Dr. Carr. I can't actually see Dr. Carr here, but he's a consultant psychiatrist and a tutor at the Royal College of Psychiatrists. He has extensive experience in the field of post-traumatic stress disorder and has worked with disaster mental health teams. He has over 200 publications to his credit in this field. It's a pleasure to have you, Dr. Carr.
Thank you. Thanks very much, Savita.
Next, we have Dr. Balaji Wuntakal, who has expertise and specializes in old age psychiatry. He's a consultant psychiatrist and has had senior management roles in the past. He works in Portsmouth at present. Welcome, Dr. Balaji. Okay, I'll hand over to my co-chair, Dr. Yamini Devendran, to do further introductions.
Thank you very much for that, ma'am. Continuing from where Dr. Savita has left, I would take immense pleasure in inviting the rest of the panelists for panel discussion number 1. Firstly, and in no particular order again, I would like to invite Dr. Nishan Goyal. He's the Associate Professor of Psychiatry in the Central Institute of Psychiatry, Ranchi, Jharkhand, India. And he's also in charge of the Center for Child and Adolescent Psychiatry, FMRI Center, and the Center for Advanced Neuromodulation and Cognitive Neurosciences. Sir has been pivotal in developing the first non-invasive brain stimulation lab and it boasts of to be the first lab in the whole of the entire eastern region of the country, with state-of-art facilities when it comes to usage of robotics and hybrid stimulation facilities. His particular areas of interest include brain stimulation, high-resolution EEG, EEG connectivity, and clinical child and adolescent psychiatry. And if I have to name a few more achievements, he has been designated as the external expert and advisory by the National Commission for Protection of Child Rights, New Delhi, under the Ministry of Women and Child Development. And to top it all, he's a traveler and a music buff. So I welcome you warmly, sir. Next, we have Dr. Anil Kumar. Dr. Anil Kumar is the Associate Professor of Psychiatry at Kasturba Medical College, Mahe, Manipal, India. He's done his MBBS at Mysore Medical College and Research Institute, then went on to complete his diploma in CIP Ranchi, and thereafter also did his DNB Psychiatry. This was at K.S. Hegde Medical Academy, Mangalore. Sir has worked overseas at Australia, and he tells us it's been at Melbourne Health in inpatient and community psychiatry for about 3.5 years. He has over 25 publications in the field of psychopharmacology, sexual medicine, and community psychiatry. I very warmly welcome you to this panel discussion, sir. Thank you. And finally, we also have Dr. D. Dinakaran. So Dinakaran is the Assistant Professor of Psychiatry in the Department of Psychiatry from NIMHANS. He boasts of quite a fabulous legacy because he is a gold medalist, Silver Jubilee awardee for the best outgoing MD candidate of year 2016. He also won the Young Investigator Award from WPA, and also the same from World Federation of Societies of Biological Psychiatry. He has around 40 indexed publications. And if he were to describe himself, he states that he's someone who is a mental health professional interested in biological psychiatry, brain stimulation, resilience, but most importantly, as someone who believes in applicability of all research in bedside clinics. So thank you once again, Dr. Dinakaran, for making it to this panel discussion. Ma'am, now I hand it back to you so that we can kickstart the panel discussion right away.
I think when we started talking about stress, I wondered because people have different views of stress and it means different things to different people, public and professionals alike. So I thought maybe we can invite our expert clinical psychologist, Dr. Rupali Suresh. Dr. Rupali, what is the definition of stress and how can we conceptualize stress?
Right, okay. So hello, everyone. I think it's fitting to start off with trying to conceptualize and understand stress because it is such a commonly used word. We use the word stress almost every day in our daily language. But and the interpretation and the understanding of the term stress, both in the layman's language as well as professionally and in research, seems to be quite different for different people. So why is that? And I think one of the reasons for that is that there seems to be a lot of confusion and some sort of a lack of clarity around the terminology or around the concept of stress. So although there has been research in stress, going from the early 30s with Hans Selye, and then sociology and psychology kind of all looking into this concept, what is not very clear is stress a stimulus, which means is it something outside the individual, outside the person, or is stress a response, which means is it something within the individual? Is it something that's happening inside the person? Or is it like an interaction between the person and the environment? So there seems to be, different schools of thought around this. And there doesn't seem to be any kind of agreed definition as such, but I think looking at it psychologically, the stress is understood as when the environmental demands of a situation outweigh the individual's perceived psychological and physiological resources. So when a person feels or appraises a situation to be beyond their ability to cope with, that's when I think stress starts to happen. And then again, there is this thing about, is it a cognitive response? Is it an emotional response? What is it? So there seem to be, all these kinds of schools of thought. And then the last bit is about, how do different people cope with stress? Because it feels that when there is a stressful situation, different people seem to react or cope with it quite differently. So why does that happen? And I think the key to that seems to be the cognitive appraisal, how people appraise a situation, how they understand it, how they interpret it, and the interaction of that with their understanding of their resources and how they can cope with it. So that in a nutshell, although it's very hard to kind of define stress, but that in a nutshell seems to kind of capture what the concept of stress means, certainly in mental health.
I think that's really interesting. And you've raised a lot of various models as well. I was reading some particular chapter in the book that's just released. And I was quite surprised to note that physiological aspects of stress were really realized long before people recognized the psychological aspects of it late in the 14th century. So that was surprising to me. And just carrying on with what you said, can you quantify stress at all?
Yes, and I think you already started off the physiological responses, and I think the stress research started off when Hans Selye started looking into stress. The stress research started off with sorry, my screen has gone, so I'm just trying to get back in. So the initial quantification started off with physiological measures. So Hans Selye was looking at things like heart rate, the galvanic skin response, and any other autonomic arousal measures. And then after that, when sociology and psychology started to look into stress, what started to become clear is that stress is not just what's happening inside, physiologically, but there seems to be something happening outside the human being as well. And sociology came up with the concept of life events, which seem to be, I think, one of the key concepts in understanding stress and in understanding how we react to stress. And so when people started to look at life events, both positive life events and negative life events and their impact on physical health, I think the shift then started to try and understand stress and to quantify and measure stress in relation to life events. So there are a number of life event measures, such as the life event checklist, the life events difficulties schedule by Brown and Harris, and then the social readjustment rating scale. And one of the key things they try to do with life events is to weight them, because there is an understanding, there's a body of research which shows that different life events seem to impact people's health differently. And so when you weight these life events and then make a rating scale that way, that seems to capture stress much better. Apart from that, clinically, when we look at stress in our everyday practice, the other way of quantifying it is looking at it as acute stress, or whether it is chronic stress, or whether it is daily hassles, things like, things that happen on an everyday basis, and then the appraisal of all of this, and then the coping mechanisms and the resources that the person has.
That's a fascinating insight, and it opens up a lot of areas for discussion and our understanding of the concept of stress. Thank you so much, Dr. Rupali. And now that we've talked about a little bit about stress, maybe we can move on to stress resilience, and I'll hand over to my co-chair to continue that discussion.
Thank you, ma'am. So I would directly jump into asking Dr. Dinakaran that he's contributed 3 fabulous key chapters in this book. So one of it is on biomarkers, the other one on stress and disaster, and another one on psychopharmacological management of stress and stress-related disorders. But the common theme throughout all of these chapters seems to be resilience. So if I have to pose the first question to you, it would be, what, in your opinion and in your field of expertise, would you say are stress resilience biomarkers? And in any which way, are these biomarkers different from the other biomarkers that we know of?
Thank you, team. At the outset, I would like to thank the editors of the book for giving me the opportunity to write a few chapters in the book. And I would also like to congratulate Professor Chaturvedi, an inspiring teacher here, on his superannuation. I wish you all the best, sir. So thanks for the first speaker, Dr. Rupali, for your insights about stress. Coming to resilience, a parallel or a complementary definition of resilience could be simplified as a positive psychological adaptation while facing adversity. So what are the biomarkers of stress resilience and how are they different from other biomarkers? When we see or read, when we review research regarding biomarkers, it is mostly related to a particular illness, development of an illness, how to manage the illness. So there may be therapeutic biomarkers which helps in identifying the therapeutic markers to say that, the identification biomarkers, and then therapeutic biomarkers where it will help us to treat an individual with a particular problem, and prognostic biomarkers which will help us to guide how the course of the illness is going to be or how the course of the problem is going to be. Resilience as such, if we could take a common example of this pandemic that is happening, everyone is equally or more or less affected by the pandemic. So the research from everywhere suggests that at least 30 to 40% individual have anxiety symptoms. But with the available evidence from the past disasters and epidemics suggests that such high number, 30 to 40%, may be there during the acute phase, but it reduces overall. By third month, it may come down, and as such, the PTSD may be around 10 to 15% during that time. So what happens? Why other individuals are not affected? So when you see how stress affects a population, broadly it can be defined into 4 groups. Mainly, the first group where they are found to be succumbing to the stress or develop a disorder as such. Second group where they have mild symptoms which do not contribute to a complete picture of a syndrome, mild symptoms with little functional disability, but they are overall able to work. And third group which had faced stress but functioning at their level of ability, and they are able to overcome and function at their level of baseline ability. And importantly, there is a fourth group which is called as post-traumatic growth group or thriving group, where in the face of adversity they function more than their baseline ability. So as such, stress is common and universal. Resilience as well has been found to be common, universal, and it is quite difficult to define resilience as such. And this is where I feel there is a distinction between other biomarkers, because these groups that I just mentioned are also not watertight compartments. A person who had developed post-traumatic stress disorder following any adverse event might over a period of time learn techniques, cope new strategies, and with the help of the support the person gets, he or she may come out of the illness and may function to the baseline ability or may even grow. So what research suggests is there is a constant dynamic process that is ongoing, which is related to the person as well as environment, which enables the resilient mechanisms in their body to cope with the adversity and come out of adversity in a successful way. So it is indeed difficult to pinpoint one factor as a resilient factor, but still there are a lot of efforts that has gone in this field, and we have quite a number of resilient markers. No, And most importantly, just absence of an illness is not a resilient marker. So that is what I would like to start. That is what I would like to start this session with.
Right, right, Dr. Dinakaran. So that seems extremely intriguing for most of the listeners, that you suggest that a population could in fact be seen in terms of their functionality and whether the functionality actually boosts or deteriorates in the face of stress. And you also very poignantly managed to tell us that this is not a watertight compartment, and there's no strict definitions of who can cope well in stress and if they can do better in another form of stress or not. So that's quite fascinating. Now, if I were to extrapolate the same and ask you about research in the field of stress resilience, are there any key insights that you can give us regarding research in this field?
So recently, the stress resilience research, or the entire stress research, I mean the resilient research, has been compared with something called immunity kind of a research. Is resilience akin to immunity? So in the same lines, is resilience natural or is it acquired? Natural in the sense through genetic makeup and a personality construct, there are certain things which make an individual resistant towards certain adverse effects. And over a period of time, we know that we have a therapy called stress inoculation therapy, where you give minor stressful things to make an individual cope better in the adversities. So whether it is like vaccination, you give small doses of stress and make an individual immune to such stress. And so is resilience overall a natural phenomenon inherent to the individual, or is it an acquired phenomena? Similarly, is it just a static phenomena, or is it a dynamic phenomenon? Are the newer ways of thinking about the stress, as you have pointed out in the questions as well, is stress specific to a disorder? Say, I mean, or resilience specific to a disorder? I have certain qualities in me which will make me resilient towards anxiety disorder. There are other certain resilient factors which will make me resilient towards psychosis. So these are the areas, key areas the research is currently underway. And if I could summarize the chapter that I have reviewed in the book as well, there are 3-4 important biomarkers which have come up in multiple cross-sectional as well as longitudinal studies and aptly summarized in systematic reviews. If I could say 2-3, I would say electrophysiological markers like heart rate variability has been, especially the parasympathetic cardiac heart rate variability has been shown to be a good resilient marker, and gamma oscillations in electroencephalography, that more than 60 hertz gamma oscillations are shown to be prominent in resilient individuals. Coming to neurochemical markers, maybe neuropeptide Y, which gets secreted along with the norepinephrine during a stressful event, tries to regulate the stress-related hormonal mechanism. So a good level of neuropeptide Y and dehydroepiandrosterone, again a neurosteroid. The neurosteroid research is getting ahead nowadays, and we have a recent evidence which is brexanolone, a neurosteroid being used in postpartum stress disorder, recently approved for postpartum depression. It enhances the GABAergic tone and thereby reduces the stress-related things. And so these are the insights I could immediately think of from the chapter that we have authored in this book.
Yeah, thank you very much for that. I think of the very few examples that you have given us, it has caused enough intrigue in all of us to grab the first copy of the book as soon as it's released and go through your chapter. And I'm pretty sure we would feel the same at the end of the panel discussion for each of the speakers that we have on board. I now transfer back to Dr. Savita to take the panel discussion forward.
Thank you, Yamini. I understand that Dr. Absal Javed is going to leave our session early. Dr. Javed, I'd like to invite you if you want to give any comments on the topic or any comments that you'd like to make to the audience or a group as a whole before you are exiting the group.
Well, thank you very much. And I'm extremely sorry that I will be missing some part, but I have just informed Somashekar and Santosh that I have been able to manage my next commitment, so I will be joining you again when Santosh speaks. But just to say one thing, that I would like that a sort of a shorter review, a 1 or 2 page review, if the editors would like to prepare, I will be more than happy to share that review on the WPA website so that people should know that how important this topic has really emerged and what a great contribution from our Indian colleagues. I will come back, but I may be just missing some part of the next panel.
That I think that's a great opportunity for us to make people aware of the book. Thank you, Dr. Javed, and hopefully see you soon again. Thank you. I think continuing on with the panel discussion, we've heard about the concept of stress and biomarkers, fascinating biomarkers of stress resilience. What happens when people don't cope with stress? You know, we know that people have developed disorders like anxiety or depression, and more chronic and debilitating ones like post-traumatic stress disorder. In this day and age, we have early intervention services for prevention of psychosis, eating disorders. I'd like to invite Dr. Carr to comment on whether we can prevent a post-traumatic stress disorder. Dr. Carr, over to you.
Thank you very much, Savita. I must say first, I must thank Professor Murthy. I think he is attending, who actually introduced me to this in the Orissa super cyclone 1999. And I must thank Professor Chaturvedi and Professor Pratima Murthy. The umbilical cord is still there, connected to NIMANS. I must thank Somashekar for giving me this opportunity to write about PTSD. I think a lot of things has happened and the understanding about PTSD has increased over the years. And we know it is a fact, it is happening everywhere. From disaster psychiatry, our research have gone to even post-ICU PTSDs. We are seeing them clinically in our psychiatric clinics very frequently. I think in UK and USA, it is a very common thing, and there are various reasons for that. I think in India also we do see them, how frequently and all that. I think it is being, whether it is diagnosed or not, but I'm sure it is there. Initially they thought, oh, it is not a, it's a cultural thing. Some people are not, they can't cope, so they develop PTSD. It is not there in different parts of the world, but it is there now. It has been proven beyond doubt that it is there. A lot of people do get PTSD symptoms, syndromal diagnosis, subsyndromal PTSDs, and it continues. Now, we know this is one illness which happens after stress, a kind of type of stress. And obviously the idea is there, whether we can do something so that we prevent it before developing, because we know a lot of people do not develop after exposed to the similar kind of stress. Almost 60-70% do not develop. So people develop. So what goes on there? Resilience is one factor. Biology we have talked about. So those are the factors. I think, and people are wondering, is there anything we can do? Now that's the kind of my question as well. I'm searching for those answers. So what we can do so that we can stop some people developing PTSD or serious sort of, stress-related disorders. The research are at a very, very low level. It's not there too much. People have tried various medicines like propranolol to antidepressants to anything, but the condition is, it isn't the robust, it is not robust. There is no suggestion or guideline suggesting you start this or anything. And even there is no for the debriefing, which was, there are a lot of research initially, and say NICE and others says, no, you don't go for debriefing. In fact, if there's mild symptoms, which is very common, acute stress reactions are common, and thanks to this, ICD-11, it is now out of that disorder group. So we don't treat that if there is a mild thing. If it is moderate or severe, yes, we do something. And we know for secondary and tertiary prevention, there are a lot of things has been done. But we are talking about primary prevention. Before developing, can we do something? What might help in the current understanding, current literature suggests that practical help. Give the person who has suffered a serious trauma what they need at that time. Okay, because each serious trauma is associated with so much of secondary traumas. I think we can stop those things happening. So if we can support them practically, and then start with the maybe psychoeducation and how to understanding about trauma and what might they might expect, what can happen, and how to prevent, reintroducing them to their own coping strategies. Don't predict or preach coping strategies, actually encourage them what they already have, because culturally it is so different. Working in India and working here, I can understand like what's happening. You can't really, so many different things are there. How do people cope here and how people in India cope there? So I think more research should focus on how we can prevent, the primary prevention part, how actually we can pick up who are the ones who is going to develop. Symptomatologically, we know that if somebody starts developing some sort of PTSD symptom, they are the ones who may develop to, develop full blown. But even those who do not have any in the beginning may also develop late onset PTSDs and other things we know. So answers might come from biological research. We may do a test and say, oh, you are vulnerable. Or there may be something that we can say that you are the ones who should have a preventive path. You must take something, not medicine, but some recourse in something what can be done. Because if you see something happens in India or our developing countries, huge number of people are affected. We can't do clinic-based interventions to deal with them. We have to go for public health interventions, and we have to think in those terms. Besides practical help, and now internet and other social media and other can have a great role in if we develop something which can reach masses straight away, rather than thinking always as a clinic-based approaches, which may not work. So that's my understanding now of prevention of PTSD. It is not robust, as you can see from, I'm talking more because there isn't much. So when there'll be very specific things, maybe we can have a very less.
Thank you so much for that. And it's always good to open up areas which are less understood so people think about it. And that's a really good insight and a future direction for people to research and find solutions. We have several other questions for you, but unfortunately, due to lack of time, we're going to sort of move on to the next expert panelist today and hold on to the questions for discussion after the meeting. Thank you very much, Neil. And handing over back to Yamini for further discussion.
Right, ma'am. So just as a disclaimer again, because of the lack of time and the time constraint, we will stick to minimalistic questions. And of course, all of you are welcome to drop in your questions at the chat box, and they will be referred to and answered in due course of time. So right now, I would like to invite Dr. Anil Kumar. And sir, as we as editors and associate editors, we already know of your contribution in this book. It's a chapter on stress and physical disorders, which is quite comprehensive when it looks at the various different systems, organ systems that are involved in the body, and the physiological impact of stress on them. Ranging from the respiratory system to the gastrointestinal system, the immunological system, and so on. But my question to you very specifically is about the cardiovascular system. I would like to know the exact psychological impact that stress has on cardiovascular health and how and what are the outcomes of it. Dr. Abhi? Yes.
In fact, one can argue that all physical disorders are psychosomatic. So the major trigger being the stress and the common pathway being the HPA axis excitement. Yeah, but the cardiovascular disorders are more important because of the fatality associated with it. And also, they are the most researched ones among all the medical disorders. In fact, depression is associated with 30 to 40% of all the patients having MI. So, depression and other mental stress, including the work stress, they have been established as the most important causative factors for coronary artery disease as well as hypertension. Apart from the HPA axis and increased sympathetic tone, even personality trait is something that plays a key role in this, especially the type A personalities. The most recent the recent finding in this research is the MSIMI, that is the mental stress induced myocardial ischemia. So this MSIMI is actually compared with the exercise induced MI, and it was found that MSIMI had a significant, more stronger association with the myocardial infarction. And also this MSIMI was more in those with depression in MI than those having no depression. Another interesting finding is some patients having MI when they presented with chest pain and when echo was done, actually the primary coronary vessels did not have any abnormalities. So there was no stenosis, no blockade. But then on further analysis, assessment of the inner layers of cardiac vasculature, cardiac musculature, it was found that the secondary layer of the microvessels, which just measured around 300 microns, they were the ones who were actually affected, and there was no major problem with the predominant coronary arteries. So it was also found in the same, there's also evidence from other research that strong emotional attacks, which are going to cause sympathetic storm, which we know, which causes adrenaline rush. So this actually damages the microvasculature more, which we cannot identify. So among cardiologists, I know if there is some cardiologist also in this panel, they now assess, irrespective of the coronary arteries, they also assess for the functionality of the microvasculature, because that is a subtle but dangerous thing that we miss here. And another interesting thing in this research is that actually in this MSIMI, they earlier used to assess the stress factors through rating scales, but now even the current insights are that they assess giving some cognitive tasks like mental maths to patients, and it is found that when the patients attempt these mental maths, there will be some transient ischemic changes in their heart. So up to this level, we can probably relate how stress can play a direct as well as indirect role on the health of the heart. So I would say that they both are very intimately related. So controlling the stress, or having mastery over one stress is definitely helpful for the cardiovascular health.
Right. Thank you for that very useful insight, sir. So that really sheds a lot of light on this condition of MSI-MI that you tend to, speak elaborately on, and how important that in our clinical practice itself, it can actually boil down to having cognitive tasks testing for individuals and looking at their level of emotional sensitivity towards the tasks, and thereby the functionality of these secondary vessels that you speak of. So thank you very much for that. I hand over the session now back to Dr. Savita. And
I also thank you all organizers as well as the editors for making me a part of both the book as well as this panel discussion. Thank you.
Thank you so much. Thank you. Yes. Over to you, Dr. Savita.
Thank you. And it's such a pleasure to have experts on the panel who have authored the chapters in the book. And it's fascinating to hear the key messages, and it encourages to go and read the whole book. Thank you for the fascinating discussion. We've heard a little bit about mental health, We've heard a little bit about physical health. Now, what about normal aging? Do we get better at coping with stress as we grow older? We would hope so. We would hope so. But I'd like to invite our expert in old age psychiatry, Dr. Balaji Vantakar. Can you please comment on the effect of aging on coping with stress and stress in general? Oh, you're muted. I'd request Dr. Manjunath and Dr. Naveen Kumar to unmute our expert panelist, Dr. Balaji, please.
Thank you. I'm back.
Yeah, we can hear you now.
I'm Shekhar, and it's very nice to see all my former colleagues, current colleagues, and also especially Dr. Chaturvedi as well. And I worked with him as a junior resident in one of the units when I was there. First of all, my disclaimer is I am no expert on stress. So let me start with that. However, I've been practicing old age psychiatry now for nearly 20 years. And you talked about how aging affects stress. I think there is a concept of frailty in old age. And frailty in old age as a concept, unfortunately, has focused too much on physical frailty rather than mental frailty. There is not much work happening around cognitive frailty. So there are few biological studies which have shown that basically in older people, when they are subjected to some artificial conditions of stress, more elements of neuronal networks are activated than what would happen in younger people. And so if the quantity of stress is gradually increased, their neuronal networks gets exhausted much more quickly than the younger people. So there is some evidence, but it's not a very robust evidence. This evidence only comes from some studies of functional neuroimaging. But a lot of work needs to happen around this area. But we know that older people go through different forms of stress due to the aging. And we need to recognize that the stressful events in younger people may not be so stressful in older people. So we need to look at those factors as well. And often these are ignored in older people because many of the clinicians who are attending to older people are of our age, and we don't often recognize what are the stresses in older people. So that's very important. Otherwise, I don't claim I'm an expert, but the factors are different, and we need to be, some work needs to happen around psychological frailty and cognitive frailty.
Thank you so much, Dr. Balaji, and very modestly you say you're no expert, but thank you very much for your contribution. I'll hand over back to Dr. Yamini for inviting Dr. Goel for further discussion.
Thank you for that, ma'am. Now I warmly welcome Dr. Nishan Goel onto the panel. Sir,
yeah, thank you.
Your chapter on biological effects of stress was quite fascinating in its own way. I would suggest that the part on evolutionary biology, where there's highlight of certain mechanisms which were initially thought to be protective in terms of our resilience towards stress, actually seems to be something that we need to take more cognizance of when it comes to leading on to or being an etiological factor to several stress-related disorders. So that was quite an eye-opener for me in your chapter. But beyond that, I would like to suggest or ask of you if you can throw some light on the various biological cascades which are involved when it's stress-related disorders that we speak of, especially when we are looking at common mental illnesses, and also what's the future of these biological cascades?
Thank you. Thank you for making me part of this book as well as this panel discussion. While we were working on the chapter, we were reviewing the literature, we found that the research around cascade of stress and stress causing damage to our, body, various functions, brain, and other things. So we found that it is not that simplistic as it's looked. We always try to simplify the concept, try to find out simple answers. But I would like to highlight four basic challenges which we could fathom. First challenge we found was that as we see, stress can be found in either environment, or in its appraisal, what a person does, or in how we respond to the stress. But when it comes to conceptualization and assessment of for differentiating these locales, we still have a lot to do, a lot to see. Secondly, there's the concept of coping. People before me have talked about resilience and role of resilience in various psychiatric disorders, people not getting affected by COVID. But when it comes to understanding why coping moderates the effect of stress, we are still at loss. It's a major challenge for the research. We have to look into this. Then we commonly see that stress happens to different people with different personalities, temperament, maybe at different stages of life. So how these individual differences, they impact the way stress is affecting or coping. So these how we can find out common answers to these things, I'm not sure. Lastly, we have to realize that stress is not a cross sectional phenomenon. Stress is dynamic. There are events, small events which come and go. There are major events that create a cascade of changes in one's life that we can assess in terms of epigenetic changes which are happening, in terms of changes in the brain happening, changes happening in the gut microbiota axis. But understanding how stress, coping, and health change in the same individual or within that individual over a period of time, it's a major challenge in this field, and we need to do some more advancements in this particular field. So this is what I have to say. Thank you very much. Over to you, Yamini.
Thank you so much for that, sir. So I think in a flow you did mention about epigenetics and also the regulation of gene expression and how that can be majorly affected by one individual having to face a lot of stress. So I guess that in itself should be encouraging enough for us to grab this book and read your chapter in great detail and also communicate to you what we feel and what more we need to know. Thank you so much for being a part of this panel, sir.
Thank you.
Over to you, ma'am. I would like you to further on with this panel discussion. Thank you.
Thank you, Yamini. I think we've just managed about half an hour, and I think we don't want to delay the program. And thank you, expert panel members, for all your contributions, which has ignited interest in going and furthering ideas about stress. And in fact, I had quite a few questions about, the concept of schizophrenia being a social disorder, and various other areas which I wanted to open up to expert panel members for discussion. But unfortunately, we'll have to conclude here and carry on our discussion outside this forum. And I'd like to hand over back to Yamini for you to wrap up the session, Yamini, and then hand over back to Dr. Somshekhar to carry on with the program. Thank you all very much indeed.
Thank you for that, ma'am. And I would take great, immense pleasure in thanking each one of you who was a part of this panel discussion. It ranges from Dr. Rupali Suresh, Dr. Dinakaran, Dr. Kar, Dr. Anil Kumar, Dr. Balaji, and Dr. Nishan Goyal for their immense support when it came to contributions towards the book. It was an absolute trying to edit their chapters. It was a humbling experience. And in addition to that, for them to come over to this panel and enlighten us about their key points in their chapters is reason enough for us to all read up the book. So thank you very much for each and every single person on this panel discussion. And thank you, Savita ma'am, for also being a part of this and just making my job easier. Thank you. I would right now like Dr. Somshekhar sir to take over the proceedings. Thank you.
Thank you very much for both Dr. Savita Shri and Amini for conducting this session. I initially thought I would summarize and give some highlighting points, but looking at the time, I think it is not a good idea. I would now go request the second panelist to start the second panel. Before that, I would introduce the chairs for the second session. One is Dr. Sagnik Bhattacharya. Again, many of you know about him. He is one of the NIMANS alumnus, and he is currently working as professor of translational neurosciences and psychiatry in King's College London, and he is also leading that on early intervention services in the same institute. And he has received many international awards, and I would like to name two of them. One is the European Award from the European Psychiatric Association. The other one is from the British Association of Psychopharmacology. He has published innumerable articles and authored many chapters. It would take time to really go into all those details. So one more important thing about his achievement is that he is named as the second best among the bioscientists who are investigating on cannabis. And I had an opportunity to work with him on one of the drug trials related to cannabis. It was a great experience to engage with him. And the second panelist is second chair is Dr. Shalini Nayak, who is currently assistant professor at NIMANS, and she has done her MD and postdoctoral fellowship in brain stimulation from NIMHANS. Subsequently, she has been working in NIMHANS. Her special area of interest includes psychotherapy, psychopharmacology, digital psychiatry, and brain stimulation. And she is one of our associate editor. And I, uh, I would not go any further about her because we already know about her in the book, and she has contributed chapters in the book. And I would request both of you to start the second session, recent advances in the management of stress. Thank you.
Hi, thank you, Somshekhar, and it's a pleasure to be here. And thank you, Professor Chaturvedi, Professor Murthy, and all my friends and colleagues. So I know that the clock is ticking, so without further ado, I will move on to kind of my specific role. So I'll introduce some of the panelists, and then I'll hand over to my kind of co-chairperson to introduce the rest of them. We have a very accomplished panel here. But in the interest of time, I might rush through some of their kind of while I describe their accomplishments. So please pardon me. So in no particular order, we have Dr. Supriya Dastidar, who is perhaps one of the kind of junior most panel members today. So she's a specialty trainee in general adult and old age psychiatry at Coventry and Warwickshire Partnership Trust, and she has been awarded the Trainee of the Year in this most difficult of years. We also have Dr. Ashok Kumar Jainar. So he is a very senior consultant psychiatrist and also a college tutor in the same trust, so Coventry and Warwickshire Partnership Trust. And he has been involved in many different roles in research involving drug trials, and has published in peer-reviewed journals and authored several book chapters. And finally, in that kind of high gear, I will move on to Dr. Shivarama Varamboli. Many of you know him. He was my contemporary when I was training at NIMHANS, and I'm delighted to introduce him. He's a professor of psychiatry and head of the Department of Integrative Medicine at NIMHANS. He has many accomplishments to his credit. In particular, I'll mention that he has given the Distinguished Speaker Oration at the Indo-Canadian Psychiatrists Association annual meeting. He has given the Vimla Virmani Award. He was awarded that and also received the Dean's Award. And he has an expertise and interest in different areas of neurobiology of severe mental disorders. So moving on, I'll hand over to Dr. Shalini Naik, who will introduce the rest of the panel, and then we'll get the panel moving.
Thank you, sir. Thank you. It gives me immense pleasure to introduce rest of the panel members. I would like to begin with Dr. Ravi Gupta. He's additional professor of psychiatry at AIIMS Rishikesh. He has immense amount of research experience in particularly sleep disorders, and he has a long list of awards of particular mention being Young Psychiatrist Award from several global societies, psychiatric societies. And I would like to move over to the other panelist, Dr. Siddharth Sarkar, who is Associate Professor of Psychiatry at AIIMS Delhi. And he has been awarded with the Sharda Menon Gold Medal, as well as the Young Psychiatrist Award from IPS. And his area of specialization is addiction psychiatry. We, last but not the least, we have Dr. Shivanand Kattimani on the panel. He's additional professor of psychiatry. He's working at JIPMA, Puducherry, and his area of specialization is child and adolescent psychiatry. He has about extensive 18 years of experience in this field. I would transfer back to Dr. Sagnik to open the panel discussion.
Thank you, Shalini. Moving on, when I think of stress, I remember that having sleepless nights, which before exams or sometimes before job interviews, which I think is quite a common experience. So perhaps I'll start with sleep, and I'll direct my first question to our panelist, Dr. Gupta, Dr. Ravi Gupta. Why is sleep affected during stress, and what happens if it doesn't get treated?
Thank you very much, sir. First of all, I'll like to express my gratitude to Professor SKC, sir, and the other editors for inviting me to contribute in this book. And sir, I think your question is quite pertinent. The issue, but when we look at the relationship between the stress and sleep, we have to understand that this is not a causal relationship. If you look at the people who get stressed and they are not able to sleep, then only a small proportion of people who are facing stress, they do not get the sleep. So somewhere there is a biological vulnerability. And this has been pointed that the vulnerability is attached to the 5-HT PPA long arm chromosome, so which is also important for the anxiety, and that actually decreases the vulnerability to the insomnia in the face of stress. Second issue is the vulnerability of the overlapping circuitry between the sleep and the neurobiology of anxiety. If we look at the anxiety, it is mainly mediated by the sympathetic system, which in turn activates the amygdala and also the prefrontal cortex and also the reticular activating system. And if we look at the neurobiology of sleep, the inhibition or maybe downgrading of the RAS by the hypothalamus is one of the important mechanisms which helps us to fall asleep. So that is another issue. Thirdly, what happens if we look at the sleep? We have two different kind of mechanisms by which we fall asleep. One is the circadian system, which is regulated by the circadian genes, and second is the homeostatic pressure. That means how much we feel sleepy. So longer we are awake and more we feel sleepy. So these circadian factors in the circadian genes, their expression alters in the face of stress, and that has been proven beyond doubt now. So these three things together, they work, and that is the reason that the patients, some of the people, when they face stress, they are not able to sleep well, or what they complain of, that they are sleeping, but they feel as if they are awake. So, I mean, the disconnection which should occur between the thalamus and the cortex during sleep, that does not occur. And that is the basis of the neurocognitive theory of insomnia, and also the hyperarousal theory of insomnia. Second issue is, you mentioned, what if we do not treat the sleep disorders which are occurring during the stress? There are two things that can happen. If we look at the molecular level and from the immune side, stress itself increases the pro-inflammatory markers and reduces the amount of the anti-inflammatory markers. And the same kind of things have been observed in the experiments of sleep deprivation. Now, it is very difficult to say whether it is this kind of immunological change, it is because of the sleep deprivation itself, or it is because of the stress arising out of the sleep deprivation. So, unfortunately, both these processes, they are so much intertwined that they cannot be separated. But in short, we can say that the immunity reduces if the sleep is not being treated. Secondly, when a person is not able to sleep well, the person develops some of the cognitive, behavioral, and emotional symptoms, which are quite similar to that of depression. And that is the reason that in many of the experiments of the insomnia and also the field studies of the insomnia, you will see a very high prevalence of anxiety as well as depression. And now some of the people say that the sleep deprivation can lead to depression. So these kind of things can happen.
So thank you, Dr. Gupta. That's very fascinating, and kind of apologies for interrupting. Kind of you have raised more questions, but perhaps it's time to move on. So I'll ask Shalini to kind of take it forward.
Thank you, sir. So I would like to invite the next panelist, Dr. Siddharth Sarkar, on the panel. And sir, you have authored the chapter, Stress and Alcohol Use Disorders. It was quite interesting to read, and I particularly liked the way you explained how the proximal factors, the childhood adversities, and the trajectory, how it eventually ends into alcohol use disorder, and what we see, the distal factor when the person presents to us. So it actually raised a question in my mind. I would like to hear from you. Can we say the early life events are the ones which would lead to alcohol use disorders? How right are we in saying that? And I would like to know your thoughts on that.
Thank you. Thank you for highlighting this issue and this question, putting for this question as well. And let me begin first by congratulating all the editors as well as associated editors for bringing out this wonderful book. Dr. Chaturvedi, Dr. Somshekhar, and Dr. Manjunatha, and Dr. Shalini, and Dr. Yamini. Now, the thing is that it has been seen that early childhood adversities, they are much more common in those who develop alcohol use disorders later. So this has been brought out by cross-section studies that those who have alcohol use disorders, they are more likely to have reported for child adversities that can be in many forms, and then can be chronic as well as or short-lasting adversities. And what has been found is that the more the adversities, the greater the likelihood. So these are some of the themes that have come from the literature. Now these findings or these association, they hold despite correcting for or despite controlling for gender, for age, etc. Now the reasons can be many, and whether these hold uh, no, uh, in longitudinal studies, now that has also been suggested that in follow-up studies, it has been seen that those who have had cities below 11 years of age, they are more to have alcohol use disorders later. This given the caveat that the assessment of adversities may be little subjective, but still nonetheless this association holds. The causality is yet to be established very clearly, and what are the factors that may go into it might be very varied, as well as there might be a complex interaction of genetics, of vulnerabilities in terms of the family environment or the social environment, social milieu, uh, the effect on the hypothalamic pituitary adrenal axis, which gets sensitized due to stress and which may lead a person to be much more vulnerable to developing alcohol use disorder when he or she starts consuming alcohol. So a primed HPA axis might itself also lead to subsequent development of alcohol use disorder. So the reasons can be multiple and complex, but nonetheless, the association needs further elaboration in terms of explanation. Thank you.
That's wonderful, sir. In fact, you had said, irrespective of the duration of the exposure to stressor, it's the number of adversities that has major connection with the subsequent alcohol use. Great, sir. Dr. Sagnik, I request you to take over.
Yes, thank you. So that takes us very nicely to what do we do about it? So our next panelist, Dr. Supriya Dastidar. So may I ask you kind of, is there any role for education, for example, either kind of at younger age or kind of later on in life?
Thank you, Dr. Bhattacharya. First of all, I should thank everyone. This has been an honor to be on this panel. I mean, there's so many great people here, and it's really interesting already, and I'm looking forward to read the book. And thanks to Dr. Somashekar as well and Dr. Ashok Kumar for encouraging me to write this chapter and the opportunity. So coming to the question, I think it's really, really important that we can, we can encourage people to learn about the stress itself and how to recognize stress, and especially important in children, because they are the future. And as we know and we have discussed here, the pattern, it's a habit, our behaviors or the way, the attitudes, they're formed in much earlier in life. So as teenagers, it's really important that these habits are developed and in the proper way, or they have the skills, the tools that they can use to recognize these stresses and also deal with it in the appropriate way. So that's the education part of it. It starts much earlier. And now we recognize it. I mean, I think we know that it's universal. Stress is universal. There's no one single person in this world who hasn't, gone through stress. And teenagers have this, more additional challenges which they face. This peer pressure, this social media pressure. So educating them at that age, basically not just to recognize stress in themselves, but also to recognize stress in others like their peers, and to signpost them in the proper direction. That's what I feel is, what I mean by education and the importance of it. Yeah.
Thank you for elaborating on that. We'll move on now. Perhaps we can kind of continue this discussion outside of this panel. But Shalini, over to you, please.
Thank you.
Thank you, sir. So I would like to invite Dr. Shivanand Katimani, sir. Sir, you have authored the chapter Stress and Childhood. So after listening to the previous two panelists who have highlighted about childhood adversities, and also while I read your chapter, it made me feel, in fact, it's my wishful thinking that could we wish to or aim to have a childhood, an ideal childhood with no stress at all. Would like to know your insights, as in, please throw some light on this.
Yeah, thank you all. I am nearly 1,000 kilometers away from my workplace. First of all, I will be using audio. Apologies. Luckily, I have a good bandwidth in this place. Am I audible to everyone?
Yes, sir, you are.
Okay, thank you. Yes, it's an idealistic thing to have a childhood without any stress, but it should not be. We all know, we have heard about other speakers. Some form of mild to moderate stress is useful. It builds a good coping skill. Only when it comes to severe stress, then it becomes a problematic. So I think some kind of stress is required to develop that resilience coping skills. That's a brief answer, I think.
Yes, sir. Yes, sir.
Yeah.
So you mean to say that you're saying about eustress, the so-called good stress, where we in fact learn our own inner strengths, we realize and we gain all the different coping mechanisms to handle with it. So in order to equip ourselves more, you're saying that having experience of stress in the past is actually would let you know your strengths, and also we are likely to become resilient. So
Yes.
it's in the context of that. Yes, sir.
Yes, the eustress is better, but the chronic continuing stress, which you call it the toxic stress, should be
Mhm.
avoided. No
Yeah.
child should be abused, but we can decrease the adversities.
Yeah, yeah. Yes, sir. Thank you so much, sir. Over to you, sir. Dr. Sanknik, over to you.
Many thanks, Shalini. So now we would like to invite Dr. Varambali. So Shivaram, it would be great to hear kind of your thoughts about, we have heard about education, but let's unpick this management a bit further. So what are the other ways that we can mitigate the harmful effects of stress, either in health or during disease?
Thanks, Agnik. Nice to see you and nice to see Somshekhar. Thank you for inviting me on this panel and of course the chapter also. The title of this is recent advances, but I don't really think there are anything very recent in stress. It's been around since man was around, possibly even at the animal level. But what is important is that each society or culture has evolved its own mechanisms to handle stress, and one glove fits all may not work for when you look at different cultures. So for example, the Western world might look at physical exercise or medication. The Eastern world might look at meditation or yoga or herbal remedies for the same. And it is important that we recognize that this kind of difference exists, and this, something that is stressful in America may not be necessarily stressful in India at all. The reverse, of course, also may be true. So it's, as Shivanand was just saying, some stress is a part of growing up, and how the child or the young adult deals with it will define how they sort of deal with it in the future as well. And there are many pointers towards a training for child or adolescent to handle the stress in the right way. Pratima was talking about the Yerkes-Dodson curve, that only once you cross the level of distress from eustress it's a problem. So seeing stress as a problem for me is a problem in itself. So you should see it as something that is beyond the capacity of the individual. And for example, in the yoga research that we have done in depression, what we have found is that when people take medicines, Dr. Andrade has written an article on the final common mechanism of antidepressant action. Whether you take ECT or you take medicine, or in fact even do yoga, there is a similar pattern that the BDNF goes down. But what we found very unusually in the study that we did on cortisol is that when people did something like yoga and meditation, the cortisol levels actually came down significantly more than just taking medicine. So I'm not saying this effect is specific to yoga, but what I want to point out is that when the person does something for himself or herself, rather than a passive sort of recipient of some help from outside, I believe it makes the person more resilient for the future. This might be psychotherapy, this might be yoga. So these interventions carry an additional advantage over treatments which are done from the outside, that the person takes responsibility for handling his or her own stress, and that becomes a sort of a format for handling stress in the future. And this is what I think we should equip people with. Not that stress is bad. Okay, like Shivanand said, toxic stress, of course, is terrible, but normal stress, how does the person face it? Can we teach him a better way? Should be the question rather than worrying about how to prevent any stress in the future.
Thank you, Shivram. This has only whetted our appetite, but I'll hand over to Shalini for, I think, the final panelist for this session.
Yes. I would like to invite Dr. Ashok Kumar Jaina on the panel. Sir, I would like to take from where Dr. Shivram has left. Dr. Shivram has highlighted about how doing something active, the person does something on themselves that itself has an effect on the condition that they go through. Having said so, we do come across at times where patients or known people, they would come and tell us that I'm going through stress, please prescribe me meds. So can we say that medicines have an effect in, managing the stress?
Yes, I would like to thanks Dr. Soma Sekhar and Professor Chaturvedi and for inviting this panel. Basically, if you go before 1950, because of the frauds worldwide, there was a concept that all mental illness have a psychological basis, childhood experiences, and these are functional illness. There was no biological basis. And late 80s, there was some emergence of biological psychiatry. Then a separate journal started, Biological Journal of Psychiatry. First time in the UK, I presented a paper about biological marker of depression. And that time, 50% psychiatrists were surprised. They were asking, what you saying? We haven't heard about biological markers. Now, every kind of illness have a biological basis in psychiatry. Stress is, again, having a biological basis, and it goes to neurotransmitters and neuroendocrine. With regard to medication and stress, 90% patients who are under stress these days using medication, may it be anxiolytic. In India, every patient say that we keep alprazolam in our pocket. When I have a stress, I take it. I have a one businessman in India, and every time his shares will go up and down, and he will take alprazolam. So medication has become a mainstay in psychiatry, and psychological concept has gone down. We no longer talk about psychodynamic, psychoanalytic, cognitive analytic, psychotherapy, all these things. Yes, pattern of reaction, interplay of reactions, emotional reactions, we can modify it by developing awareness, learning about self, learning about self-coping skills. But medication is the mainstay. And particularly these neurotransmitters, if you say, we always say two type of neurotransmitters creating toxic effect and calming effect. And we need to keep a balance. Doing this yoga or stress relieving exercise, these calming neurotransmitters or calming chemicals increase. There has been PhD in America. They found that doing meditation have a powerful impact on parasympathetic nervous system. But again, it goes to the biological basis. Yeah. Any other?
Thank you so much, sir. Sir, I was actually quite fascinated to hear from Professor Chaturvedi as well as Dr. Somsekhar that the inception of this book had initially begun with early interactions with you. So today the book is being released. I would like to know your opinion on that.
Well, it has, like, it is a landmark for this book has come in a manner where it had so much ups and downs in the beginning. Dr. Somasekhar has been very motivated. He was determined, we have to publish it. And he was able to find a world-class authors. And he achieved this landmark of this at the time of retirement of Professor Chaturvedi. And it is a lifelong memory for us. And these books will be selling like a hot cake, I can guarantee. It has been one of the best book I have seen in the last maybe 1 decade. I'm not saying that I'm part of the one author or two author, but it is very, 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 very hot book at the moment. All laymen, public, executives, corporate world, they need to read this book.
Thank you so much for your encouraging words, sir. Over to you, Dr. Sagnik.
Hi, thanks, Shalini. I'm sure that all our panelists have stimulated your appetite to talk deep into the book, but I think we are also very keen to hear from Professor Chaturvedi. So over to Somshekhar. Thank you.
Yeah. Thank you everyone for giving your comments as a panelist. And thank you, Sagnik and Shalini for chairing the last session. And I'm sure you all agree with me that the quality of discussions were of such a nature that this is just a gist of a book. If you read the books, the content in each chapter will give you more information, more answers to the questions raised by several panelists, and the thoughts which you got into your mind when the panelists were answering. Now, what I would request is Naveen to conduct the next part of the program. And I think it is very difficult to introduce Naveen. He is below 50. Already he has 8 awards. He is professor of community psychiatry, adjunct professor of psychosocial disaster management, and he is also reviewer for nearly 10 international journals. So I don't want to embarrass him by giving all those details, but everybody knows about Naveen. Naveen, it is over to you.
Thank you, sir. Also, we are running short of time. So
Yes.
before I ask Professor Chaturvedi to speak, it's my pleasure to invite Dr. Prakash Hosalli to share his experiences of working with Professor SKC, sir. So after that, I'd request Professor SKC to speak. Sir, Prakash, sir, please, sir.
I was hoping to hear Professor Chaturvedi first, but anyhow, it's always a privilege to hear Dr. Chaturvedi. I had the privilege of working with him for a short period in my last posting as a junior resident. What can I say? It's in the name, when we say like SKC, it's like a mixture of, sweet currant coffee, a good blend of that, sweet and currant in sense of like, his humor and critical analysis is well known. And his support for the juniors is very well known. That's the cream, it's like the coffee in the end, I would like to share an anecdote, we all know how stressful it is sometimes, even though very stimulating working in NIMHANS, it's also stressful. You all remember the departmental seminars, once I was presenting on history of psychiatry. Professor Pratima Murthy was chairing it actually. Those days where it was not the PowerPoint days, I had made some photographic slides and projected on the screen and indulged in showing some exotic photos and facts and figures and blabbered for more than an hour or so. And then as usual, people make comments and various comments, some good, bad. And, one of the comments was like, oh, Prakash, you gave lots of facts. I was expecting more. It's, you haven't given much your opinion. You've given various facts. And, to be fair, it was not an unfair comment. Probably it was right. But I was thinking how to defend this. And then I was not even worked with Dr. Chaturvedi at that time. He commented immediately, no, the role of the historian is to give facts and evidence. And then the audience have to make up their mind, and make their judgment. And it was an excellent presentation. He said, the kind of moral boosting kind of comments he used to make, for the juniors, it was, it's always a pleasure. So I think, people would like to hear more from, as I said, is the sweet blend of sweet currant, coffee and the cream of Professor SKC. So I wouldn't take much time in I would like to hear from you, sir.
Yeah. Thank you very much, sir. Sir, SKC sir, now the stage is yours, sir.
Okay. Thank you. Thank you all of you for joining. I must say that first about the book, then about myself. Okay. And as Dr. Ashok said about this book, you know, we started the process a few years back, and then, you know, every time it was getting stuck. And I must compliment the perseverance of Somashekar. He had made up his mind that this should be done, and we didn't know what to do. And then came in one gentleman called Manjunatha. Manjunatha, can you put your video on? So Manjunatha was there, and he said he got after the authors. Here he is. He got after the authors and gave them strict deadlines, gave them reminders, and you know, I think and thanks to COVID, because nobody was going out anywhere, everybody was on their desk, and they had nothing else to do, and they sat down and wrote these chapters, and we finished it well in time. And you know, as you see, the book is out. Not only the book is out, I must say something else. He kept on getting offers for more chapters to be contributed. And I think that Dinakaran is here. He said, can I also write one more chapter? And Manjunath gave him 48 hours, you know, and it was, I told Dinakaran, you can take 72, you know. And so we got his chapter, one of the last ones in this book. But Manjunatha tells me there are 4 or 5 other aspirants. So we have already decided on the second edition of the book. And it's a bit difficult because it's too stressful a book to read in one go. And so we are thinking of, you know, coming out with 2 volumes, volume 1 and volume 2. The second edition would be in 2 volumes, and we should have it by the middle of 2021. Now, so I would like to you know, thank each and every author, and thank all of you for, you know, we thought that one way of talking about the book is, you know, having a symposium on the topic. And I remembered Savita's chapter, which she had written on stress and immunity. And I actually had the pictures which you had made, you know, and we was thinking in the second edition, we'll have your chapter, and one from Rupali as well. It's such a joy to see all of you. I think Naveen and Manjunatha, you know, they were planning to have something called as Guru Vandana. I said, no Guru Vandana. I would like to listen to some, you know, discussions, good discussions from all of you. And a number of you have worked with me very, very closely. You know, Rupali has worked with me on projects on eating disorder, and Savita has written quite a bit. Suresh has written with me, Suresh and Rajesh, you know, in the rehab team. Both of them worked with me on, and Chitranjan on single dose lithium. And then I saw Praveer there. Praveer did some good papers with me on you know, dissociative disorders, conversion disorders, published in the ACTA. So you know, I have, my career is incomplete. And then Sagnik, you know, he did a very good case report in the Canadian Journal on metamorphosis of a delusion of pregnancy. And Sagnik, it is still a very popular paper, and I keep getting inquiries about that. So my journey is incomplete without you. And you know, as Pratima had mentioned, I'm having a month full of, you know, occasions to share my thoughts, and you know, all sorts of farewells. This is, of course, you know, as Absal was saying, this is not really a farewell. I'll join Absal and you know, work with him for whatever it is, you know, I can contribute. So it's been a joy and pleasure to work with all of you. And when I joined in 1982, and that time there were, you know, people, some of them, the residents have already retired after their careers, but I had very good senior residents, you know, Dr. PSV and Sharma, Murli Sharma, K. Srinivasan, you know, and Savita was my senior resident too. And a lot of people who have worked with me. Somashekar, of course, worked with me for a very long time. at the end of my, career at NIMHANS, I reflect back and, Afzal was talking about the education, about psychiatrists. So I'm not a very good, what shall I say, a good example of a trained psychiatrist, because I did psychiatry in PGI and it was only for 2 years. Okay. And that time we didn't have a thesis. So if I can do psychiatry in 2 years without a thesis, should we not take an example from that? Why should we have it for 3 years and have it, with a thesis and other things? You tell me, am I not good enough? I have learned enough to, train hundreds of people, who are spread all over the place. So I think we need to rethink about the training in psychiatry, which has gone on. And then because it's about stress that we were talking about, and I think one of the first panelists talked about the Holmes and Rise. Yeah, Rupali talked about, the Holmes and Rise social readjustment rating scales. So if I see that, what are the stresses I have gone through in this? Let's talk about some of the negative events and the positive events. The negative exit events. I lost my father, I lost my mother, I lost my grandmother, I lost my brother. I lost Tiger. I lost a tiger I had. It was my pet. It was obviously a dog, and I lost friends like Dr. Pandey and, Dr. Bhatti. So I lost a lot of people. But then I had 2 weddings during this period when I was head of the department within a 6-month period. And now I have 2 grandchildren. I did 2 fellowships, both of them in England. One in 88 to 89, 90 in Manchester, in working on cancer, and then worked on Stoke-on-Trent and the International Fellowship. So I've had all types of life events, and I have survived that. And I have survived that by 2 ways. One is, of course, I like to write. So I have written with a lot of you, and I've written much more than that. And the second is that I like to have fun. I work with fun. I learn with fun, and I have fun with people. So that has kept me going. And I have, good friends, not only in the UK, but in the WPA. First, it was Dinesh Bugra. Now it is Afzal Javed. So I have gone on, and it's been it's been a good theme, a good journey that I've had. If you notice, the topic, the title I had given to my this session was Unmentor, Mentor. And as Prakash was saying, I think in the initial part, I was not really a very good mentor. I was quite critical at times, and sometimes my humor fell flat, or sometimes it must have, looked like I was making fun of them. I was not making fun of anyone. I was actually making fun of myself. And so I was a mix of negative mentor and positive mentor, and it was really good time. I said in a couple of my talks that why do I always go back to NIMHANS from England? And it's not that I couldn't stay there. I could have stayed there like you guys have stayed. It was for 2 reasons. One is the patients. And you get the most challenging patients. All of you should come back and spend a month to see. You can learn 1 month. You can see the types of variety of the most difficult cases. NIMHANS has become such a point in the country that the most difficult of cases from all over the country and the world come there. So you get an opportunity to really treat the most difficult ones. And then, of course, my residents and my students and trainees who have been such a joy. This new batch comes and I bubble with excitement. This person will not be knowing anything. I start with first rank symptoms, definition of hallucination, delusions, and making diagnosis until the final years, and teaching them or learning from them. I've always learned a lot from my own students and on my own patients. So it's been a really a great time, a lifetime of joy with working with you all. And I wish you all the best. And I thank you all. I know in England it's quite cold, and you're spending the middle of the day, prime time weekend with us. Not that you had anywhere else to go, with your lockdown, you can't go anywhere. But maybe it kept you away from your Netflix and OTT, whatever you would have done. So thank you very much. And now back to Naveen and Somashekar. And if any of you would like to, give me a feedback, what was it that I did well and what could I have done differently to make your lives, worthwhile?
Thank you, sir. Any one of you would like to speak a couple of words on the experience they've had with Professor SKC? They're welcome.
Actually, and you can speak in front of me. I'm no longer your teacher. You are, you are, an authority in your own sense and in your own places. Yeah, Suresh. Yeah, that's
Dr. Suresh, and followed by Dr. Vaijayanti.
Okay.
Dr. Suresh, we're trying to. I think you can speak now.
Yeah, thank you. Thank you very much, Somshekar and Dr. Chaturvedi, for giving me this opportunity. I really remember very fondly the time I worked with you in the KNS unit. I remember seeing lots of patients in the OPD, very busy day, and you would be in your office sitting and we would come to you for discussion. You would normally be writing a paper or something like that, not using every bit of time that you have got. And of course, you had a very good sense of humor. I still remember you telling me when I presented a case, because I was asking the question, why are you depressed to patients? You said, don't ask why, because they may not be able to say why, because they may not be able to remember the stress and what they have undergone in their life, etc. But ask more about how they are feeling, describe the depression rather than asking them to identify a cause for it. So that lesson has really stuck with me. So, I mean, there are plenty more that I can recount that I have learned from you. So I wish you all the best in your retirement and many more years of contribution to psychiatry. And of course, I will, hopefully I'll have an opportunity to meet with you sometime when you come to the UK or when I come back to NIMHANS. Thank you.
Thank you, sir. Vaijayanti?
Yes, sir. So I think I remember SKC, sir, from the first day I joined MD. Unit 4 was my parent unit, so it definitely meant a lot. And all the case discussions and everything were actually really good. More so because I think we would focus on areas that were a lot more psychosocially stress related and, sexual activity related. And those kind of things are going to give us a lot of perspectives. In first year, I was like, okay, I don't know what to do. I don't know how to elicit depression. I don't know how to ask for suicidality. And I'm like, I don't know how to talk about sex. But then, eventually we learn a lot of things and it has grown on to be one of the areas I'm really interested about. And also about psycho-oncology. My thesis was on it and sir has also guided me a lot along with Prabha ma'am. And I think it was a great opportunity to be able to see things from different perspectives and learn a lot of things. And I think the most difficult questions were after you complete your OSCE and you were like, so how would you want to rate yourself now? And a 6 would be too low, a 8 would be too high, 7.5 we would never think of. So I think those are different ways in which we have learned how to ask things, how to give a very genuine feedback without trying to be harsh. I think you've learned it a hard way, like you just discussed, but you made it easy for us to learn about it because we observed a lot of things from you, which has given us a lot of confidence. And I really enjoyed working with you. I know I've written only one paper and I'm very happy about it. And I hope we get to work more together sometime in the future.
Thanks.
All the very best, sir.
Thank you. And Dr. Hiremat, sir?
Yeah, hi, friends and colleagues. It's such a pleasure to see all of you. Like Pratima Murthy mentioned earlier, the umbilical cord can never be cut. And once I had visited NIMHANS many years ago, bumped into Sanjeev Jain, who asked me, what brings you here? I said, nostalgia. And he said, oh, that's a terrible, deadly disease. So it's a disease you can never get rid of. Now, allow me to introduce you, myself. I'm an alumni from the 1999 to 2002 batch. I currently live and work in Leicester. and it's really a pleasure to connect with you all again after many years. I'll just remember one anecdote from Professor SKC's ward rounds. Professor SKC's ward rounds were phenomenal, with knowledge and a lot of humor at the same time. So it was exam time, and Professor decided that he'll ask us some questions to put us through our paces. And he asked us a question, and there's always the slowest finger first, isn't it? You don't want to volunteer an answer because you might get asked more questions. So all of us decided to just keep quiet. And he said, "This is looking very dangerous. You're all going to pass the exams without reading." So that was the nature of demands, with the bounty of vicarious learning. So my sincere thanks to Professor for having taught us and all the other students through years in demands and everywhere else. Like again, colleagues mentioned earlier, there is no such thing as retirement for you, sir. And hopefully we'll see you again very soon. And it'll be a pleasure to work with you at some point again. Thank you.
Thank you. Thank you, Dr. Hiramat. Dr. Praveer is there. Dr. Praveer.
Dr. Absal Javed wants to talk.
Yeah.
Okay.
Dr. Chaturvedi, namaskar. I, as you recalled, I did a paper. We did a paper together, and that all I can remember very clearly is that I was never hassled or spoken to. I was always spoken to in a way which was most respectful, and I think I have. If that's one thing which I can say about you, is that you were so humble and giving respect to even students and trainees like me at that stage. That has remained with me as my very endearing memory of you of all times. We have met after that when you came to UK. We met here in Birmingham, and it was such a great pleasure welcoming you to our house. It was just lovely to remember and recall all the good qualities which I have imbibed, or which I have tried to imbibe from you. So you were my favorite trainer of all times.
Okay.
Thank you.
Thank you, sir. Dr. Javed, sir, would you like to speak? Yes, sir. Please,
Well,
sir, go ahead.
Well, thank you very much. I do not want to disturb and disrupt the good memories that Dr. Chaturvedi's students and colleagues are sharing. I just want to ask two very, very short questions. I know that Santosh started his career in psychiatry during the last century. So this doesn't mean that you are very old. So based on your experience and expertise, two very short questions. What do you think that what should be the take-home message for our future trainees? Number one. And number two, how do you see and how do you look at the future of psychiatry in the coming years?
Yeah, Absal, ये तो आपने वाइवा बना दिया मेरा.
No. This I think this will be one of the best asset of this meeting, that we will be learning from someone who has really spent all his life.
I think for the trainee and the training of psychiatry and in training programs, it has to be very, very dynamic. You know, we have to be very, very practical and dynamic in what we teach and how we teach. And I think the days have gone, you know, like when the times when you and I studied, Afzal, and now there is so much of technology and so many other things people use. So now it's very different in rounds. Avinash mentioned and Prakash and this thing. Now I ask a question and I ask them to look up the answer in their phones. And so they open Google or they open Medscape or something. At least they know. So they give an answer, so there are not many silences. But I think the curriculum has to be dynamic and training has to be dynamic. Coming to the future, I think the future of if any branch of medicine is bright, it is psychiatry. And as we saw, whether it is COVID, but the second issue after COVID was mental health. I have done so many programs in the mass media here in India, and I think every time they call a psychiatrist or a mental health professional or a psychologist to talk about. So the future of psychiatry has become a part and parcel of each and every medical specialty. And as we find, as you know, we have been discussing about stress. So stress is there in every branch of psychiatry. You know, one of the panelists mentioned that medical illnesses are because of stress, and medical illnesses cause stress. So and mental health professionals, psychologists, psychiatrists, you know, social workers, counselors, they have a very important role. So the future of psychiatry is very vast, and I think we need to diversify. We need to make friends with and network with other branches of medicine and surgery, and you know, make them you know, people aware of the importance of psychiatry and mental health and all that. So I think the future is glorious, and I hope that, you know, people would be able to appreciate that and, you know, move on with that. Thank you, Absal, for those questions.
Thank you, sir. Now it's over to Dr. Rupali Suresh. Ma'am, please.
Okay, thank you very much. I just wanted to say, good luck to Dr. Chaturvedi for his retirement, but I want to also mention the work that Dr. Chaturvedi and I had done over 25 years ago when I did a project on eating disorders and also psycho-oncology. And I must say that was the first time when I was working closely with a consultant psychiatrist in NIMHANS. And he really demystified psychiatry to me. He was, you know, so candid. He was down to earth. We used to have some great supervision sessions when I used to go and work outside. And he had a very nice way of pushing me outside my comfort zone. So every time, because I was very young at the time, really inexperienced, just very newly qualified and always scared of psychiatrists. So Dr. Chaturvedi was the one who really made me feel comfortable. And the things I learned about research from having worked under Dr. SKC, as well as statistics, because I remember you used to send me to the stats department all on my own to discuss all these statistical packages. And I think that is what one needs, the mentoring, you know, the gentle pushing, but yet feeling held that, you know, you're not going to be just thrown off a cliff. And I think Dr. Chaturvedi has that great balance between being a mentor and yet a hard taskmaster. So just a huge thank you, SKC sir, for being my first mentor. As soon as I qualified. And I think I've taken those lessons right up to today. I wish you all the best for your retirement and hope we catch up again sometime soon, face to face. Thank you.
Thank you.
Just to share a chat, Dr. Suresh has written, Rupali is scared of psychiatrists. That works very well for him. Now, my request, Dr. Sagnik Bhattacharya, sir, please, sir.
Hi, yeah. SKC, I don't know whether, sir, you remember, I was on your side when I got posted in MKI unit during my residency, and you mentioned about the paper that kind of we wrote together. It just kind of looking back at those days, I thought that I'd just share that it was, you may not know that it was my first paper, so it was the start of a journey, and thank you for initiating me into academics in some way. It was just only a kind of a research letter, so nothing great. But it was particularly important for me. On the other hand, you took it as if it was the most important paper for you as well. I'm sure it was kind of by then the 200th or whichever number it was. So that was really very kind of inspiring. But I think one of the other thing perhaps which many people would have observed is never to take oneself too seriously. So that's very hard to achieve, but that was also something very very inspiring to watch. Thank you. Thank you for the time you spent with us.
Thank you, Sagnik. Thank you.
Thank you, sir. I think we have, I think those are the, sir, now I'll hand over to Dr. Somsekhar, sir, for the next.
Okay. Thank you, Naveen, for conducting that last part of the program. I started my junior residency with SKC and ended up living NIMHANS with working as a senior resident with him. And I have hundreds of anecdotes Probably I can write a book about the anecdotes I had with him, but I would like to share one anecdote. Probably that will give you an idea about how humorous as well as his presence of mind when seeing people. It was a young man who was in his 22-year-old. He was brought to hospital from his family members saying that he is aggressive, irritable, angry. Then everybody thought this person has psychosis. So SKC asked him few questions. Then this boy said, I am in love with somebody. And he said, SKC asked him, do you get his dreams about this girl? He said, yes. Do you find it difficult to remember, forget her? He said, yes. Do you find it difficult to live without her? He said, yes. Then SKC said, this person's diagnosis is love. That was the first really amazing experience I had with SKC. I think there are hundreds like that with him. This is the way he taught psychiatry to us. And I'm so grateful that I had an opportunity to work with him. And I wish you a very best post-retirement life. But I know you won't retire, but formally post-retired life. And we will like to continue to work with you. Before, yeah, yes, sir.
Continue, sir, please.
Yeah, before concluding, I would like to thank two more people besides all authors, everybody who has contributed to this book directly or indirectly. One is Dr. Ashok Kumar, who has a constant support for me to really carry on with this book and help me a lot, both morally as well as in all possible ways. The second person is Dr. Manjunatha from Nimhans. I think he acted as a catalyst to bring up this book. I don't think I would have been successful without his help, his serious commitment. So many thanks to both of you. And thank you for all the panelists who have contributed and made this program a success. So now I would request Dr. N. Manjunatha to give vote of thanks.
Thank you very much, sir. I think all of us are waiting to leave the meeting now. So before we end up as a formalities, I think it is an opportunity for me to extend thanks to many people. First and foremost, I think I should thank to all the participants first. Okay, all the parties, thank you very much. Without your participant, I think this would not have been successfully done, and it is a memorable academic event which I had in my life. Thank you very much for all the participants. Next thanks to all the panelists who has agreed to be panelists, and all panelists, majority of the panelists were authors also. Thank you very much for your commitment, time, management, and your responses was a reflection of your chapters. Thank you very much. Next is to all the authors. There is a 69 author. We have 69 authors for the chapter. And actually, to be honest, if you take the very, very rude word, I think I have harassed all the authors whom I contacted, because when I have been called to be, actually it was opportunity for me when SKC sir has called me and said that we want you to be editor for this. I thought even if you would have offered me not editor, I would have agreed to work with him. And it was when he said editor, I think it was really excited offer for me. And I said, sir, how much time is there? You tell me how much time. I said, sir, this is because this is COVID-19 was ongoing. And I say I think it was on September 1st, if I don't remember, probably 1st. Sir, within 1 month, we'll get all the chapter. That's what I said. Within 1 month, how? I said, sir, I will contact whom I know personally, and I will keep reminding them every week. And Somshekhar sir was very polite. Don't send message. They may get irritated. And I said, sir, it is a friendship which I had, and I have committed to Dr. SKC sir, because we are, and he will get retirement also. Before retirement, I want this book to be real. So I thought, and I personally spoke everyone that this is the thing, and we want chapter to come. And I'm sure, I think majority of every author has committed, and agreed to be part of this book. And everybody has sent the comment. And in fact, about the editing we have asked, they have happily agreed. And thanks to all the authors, and at most very important person whom we should thank is the Dr. Absal Javed, who is president of World Psychiatric Association. Thank you very much on behalf of all organizing committee, sir. And actually, Dr. SKC Chaturvedi sir said, we will request Dr. Absal Javed to write a foreword. I didn't know what was the equation between you, both of you. And I said, it is a big, sir, very big. Then that's the response I give. Thank you very much for giving us forward as well as this book release function, sir. Thank you very much with your commitment. And I think it will have, I think we is a small contribution to the humanity where we are giving some, this is a very, I think probably, Dr. Somshekhar sir has asked me to write chapter a few years back. And maybe that book was waiting for COVID-19 to come. So I would take that as an opportunity in that way. Thank you very much, sir. And I would like to extend our thanks to our director, Dr. Gururaj sir, and our Dr. Pratima Murthy, who is head of the department, who is a guiding force for all of us. Thank you very much, madam. And we would extend the thanks to Dr. B.M. Suresh, who is head of the telemedicine center, where we are sitting, all of us are sitting here, and he was a constant support. Actually, when Dr. SKC has offered me to work as an editor, and I was in a little dilemma. I will tell you why I dilemma. SKC sir is very particular about time. And I was caught up with last chapter. I was really scared because that date was 16th something, maybe 16th January, I thought. And he brought it 1 month before only, December 16th. So something like that, I misguided the date and I was a little scared. So when I went to Suresh sir and asked sir, SK sir has told me I'm little scared. I said, no, it is a good opportunity. You work. You don't stop other work. You work with him. That is the response you have given. Thank you very much, Suresh sir, for allowed me to work with SKC sir, and as well as allowed us to use the telemedicine facility also. And thanks to all organizing committee members, including our associate editors, Dr. Shalini and Dr. Yamini as well. And I think probably I am the person who has called up repeatedly and said, this is the time. You have to finish. You have no choice. And the commitment was that initially when I spoke to her, actually the choice was given to me by SKC sir to choose associate editor. And I was in a little dilemma whom to choose because it is a time-bound work. I cannot just work. Then I found both of them are closely worked with that. And I think I troubled you people. If it is troubled, please excuse me in that way. Thank you very much. Then Dr. Vijeta S, who is a radiation oncologist, and is a friend of Dr. Yamini, who has given her artistic feature in the book. I am sure all of you will receive the book and you will see the artistic things which she has written. And Mr. Rohin BS, who is a medical student at Bangalore Medical College, he is also part of the art of the book which he has given. And thank you very much, madam. Dr. Yamini, please extend our thanks if they have not participated here in that way. Yes, Dr. Naveen.
I thought we'll request our HOD, Professor Pratima Murthy, to give the concluding remarks, boss, after your speech. After your,
Yeah, madam is there, huh?
Yeah, ma'am is there, ma'am is there.
Okay, thank you. Okay. Then, and at the end, I think I would say I extend thanks to our backend staff, Dr. Mr. Naveen and Mr. Gautam. And as I said, it is actually, I would say that is one of my area of interest in psychiatry. I think somewhere I lost interest in psychosis. I don't know why. And maybe I am closely interested in common mental disorder, especially anxiety disorder. And this book has really opened my avenue to work further in my future career. And thanks to both Dr. Chaturvedi and Somshekhar sir. Thanks all of you for joining this evening. And now I can request Dr. Pratima madam to conclude remark. Madam.
So the advantage of being HOD is that you get to have the last word. And especially when all my faculty are participating, including Dr. Chaturvedi.
You are still my boss. You are my boss.
prerogative. And of course, I think, I just wanted to say it's been a pleasure to, to see all of you, to have this book released, to look, to understand all the different nuances that are presented here. But again, most importantly, I think to all come together to wish Dr. Chaturvedi on the eve of his superannuation and wish him all the very best. And I'm sure he's brought together a wonderful team. And like all of us, I hope we do get to see volume 2 shortly, and hopefully with no COVID in the picture. So thank you all very much, and congratulations to the editors, to the sub-editors, to just all of you. And thank you for being here this evening.
Maybe next time, say SKC sir will be in the UK and we will participate from India.
Yeah.
Hopefully that way. So there will be reverse in that case. Thank you very much, all of you. Good evening.
Good evening.